Happy Monday morning, everyone. Guess what? We're here with Harpeth Valley Dermatology, husband and wife team. I hope I'm gonna say this right. Dr. Beige Shrez and Dr. Megan Morrison. How are you
Yeah,
guys doing this
hi.
morning?
We're doing
Good,
great.
how about you?
Good. So we were just chatting before we went live here. It's always great to have a new dermatology office open because I feel like there's been a shortage lately, and it takes a long time to get in with people in this area. Tell us about your new office that you're opening in Thompson Station.
So we're located in near the Tollgate Village. We've been open since September 14th. We're definitely taking new patients, and we're excited to provide service to the area because there is a shortage, and there's also a lot of growth happening in this area, especially. So I think we're here to kind of serve that.
Yeah, and we've lived in the Franklin area for I think around 5 years now, and have been working in Smyrna and Murfreesboro for that time. And we're happy to work closer to home and provide much needed medical care to our neighbors and our friends. And I think something that's unique about our practice and where we are is that we're all board certified dermatologists, and a patient's going to be guaranteed to be seen by a dermatologist when they make an appointment with our practice. So we're very excited to serve our community.
Yeah, tell me about some of the things that you guys offer at your office, which may be a little bit different than other places.
Well, we are full service, meaning we're comfortable seeing all ages from infancy all the way through the elderly. We also pride ourselves in medical dermatology, and so we're very comfortable with skin cancer, especially Dr. Morrison here, who does Mohs surgery, which is the gold standard for skin cancer surgery, but as well as other things like autoimmune diseases like lupus and such. And so, we provide that. We have also Dr. Bashline, who we work with as well. He's a good friend of ours for several years, and he's part of the practice as well. And I think we all bring kind of a unique perspective to the situation and complement each other really well.
Mm-hmm. We also offer multiple laser services for, our cosmetic patients. We do have some resurfacing lasers as well as kind of photofacial IPL lasers that we do have within our practice. So we're kind of full spectrum. We do, like you said, from pediatrics all the way up to large skin cancer repairs and cosmetics.
Tell me, what is one of the things that you're seeing right now with the change of weather? What are people coming in for with their biggest complaint right now?
Yeah, the biggest thing right now is dry skin, especially with everything going on with COVID. Everyone's very hypersensitive about washing their hands, which is great. I wish everyone had always washed their hands that well, but especially now with overwashing of the hands and the seasonal changes, now that the heaters are turning on, people's skin is really starting to dry out. So that's probably one of the biggest complaints I see now. And, so educating patients on moisturizing their skin and just good skincare regimens, what soaps to use and things like that is kind of a hot topic right now.
Plus also maskne.
Yeah, a lot of maskne.
Because with all the mask wearing, a lot of occlusion there, which can break out a lot of people who didn't have any breakouts in the past.
Right. I know I personally went through a little period where I was getting breakout around my lips. I guess it's when you're trying to talk through the mask.
Right.
So I don't know if that's something that you've seen as well.
Yeah, we've seen and experienced.
Yeah.
So we definitely have some tips for that.
Right.
What is the one thing you would say for people? I figured out even though I was washing them, I felt like I could only wear them once and then I had to wash them because that helped a lot. I don't know if that's what you've been telling patients.
Yeah, definitely washing them a lot because you don't realize how much bacteria is in your mouth and how much you're talking into the mask, and it just grows there. And if you put it on again the next day, it's just like a petri dish on your face. So definitely good to get a new one every day and make sure that you're washing it appropriately.
But also cleansing the skin as well. Yeah. So, such things as even over-the-counter products like salicylic acid are good to clean with, in addition to having good mask hygiene.
Those are good points to know. What is one of your most popular, probably cosmetic procedures that people come in and seek you guys out for?
In terms of cosmetics, probably toxins and fillers. Now that we're getting into fall, it's good laser season. So a lot of resurfacing, full face resurfacing. Now that it's cooler, it's a little bit more comfortable to do it this time of year.
Yeah.
Yeah, we do a lot of the CO2 laser, which is something that can take care of fine wrinkling, and also kind of some of the dark blemishes one might not be happy with just from long-term sun exposure.
The CO2. Is that the one where your face peels and it's like a 5 or 6 day process? Is that the one?
Yeah, it's a pretty aggressive laser. You definitely have to have a little bit of downtime for a few days to not be out in the sun, because your new skin is very much vulnerable. But then you start seeing the differences after a week, and you continue to get differences for up to a year, actually, with just one treatment.
Wow, up to a year. I didn't realize it was that long.
Yeah, just slowly it stimulates collagen, and I tell patients it's kind of the most bang for your buck in terms of reversing aging of the skin. It really kind of tightens up the canvas, and then you can kind of see if you need filler or Botox after that. Sometimes people don't.
That's fascinating. Wow. What about since we've been inside, are people still need to come and do their like skin cancer checks? You still recommending people come and do that?
Absolutely. I like Dr. Shrashi said, I do Mohs surgery. So the most common thing I see is skin cancer. And 80% of the sun damage people have is actually back from when they were a teenager, before they're even 18. So just because you're not in the sun right now, and just because you have an inside desk job and you think you're not in the sun, back when you were 16 years old at the beach in a bikini is really what's going to start catching up now. So absolutely, people should stay on their routine of annual skin checks, and if they notice anything like a pimple that doesn't heal, they should absolutely be seen by a board certified dermatologist, because a pimple should not be there longer than a month.
Oh,
yeah. And it is something that, for anyone starting at the age of 50 is a good time to set a baseline if you haven't already. And then after that, it should be like a yearly exam at age 50 onward. Now, certainly if things are found during that time, like skin cancer, we end up seeing you a little bit more often just because there's a higher risk of getting a new skin cancer as well.
Wow, that's good to know. Tell me, you have a grand opening coming up, right?
Yeah.
Yes, yeah. We're going to have a ribbon cutting and a grand opening coming up in November. We don't have a firm date on that yet, but we'll be doing that in November.
Okay, well, we can check back and learn more about that. I heard you're going to maybe do some specials or at least do an office tour for people.
Yeah, the office will be open for tours, and we'll be having some specials on lasers and cosmetics. Like I said, now that it's cooler outside, this is the time to do it. Yeah, we actually have a special, we're kind of in our soft opening phase right now, where we are open for patients now. But we do have a $50 special right now off of filler and Botox, or in Dysport, which is just a different brand. But there are specials going on right now, but we will absolutely have some more in November when we have our ribbon cutting ceremony.
All right. Well, that sounds great. Tell everybody where they can find more information if they want to become a patient or come and visit you guys.
So on our website, it's harpethvalleydermatology.com. There's a link to become a patient. You can just fill out some basic information about yourself as well as your insurance information, and someone will contact you from our office to get you scheduled for an appointment. Like we mentioned earlier, we have been in Smyrna for a long time as well. So we have 2 offices. We actually have an office here in Thompson Station, but also an office in Smyrna. So if you're kind of in between those 2 locations, we can get you scheduled at either one, whichever is more convenient for you. But feel free to follow us on Facebook, Instagram. And like I said, our website's probably the easiest, most inclusive place to get all the information about our practice.
All right.
And we are at each office. One of us is at each office Monday through Friday. So there's no weekday that we're closed. And we do take most commercial insurances and federal plans, Medicare and Medicaid.
All right. Those are all great things to know. Well, thanks so much for joining us this morning, telling us more about what you guys have to offer. You guys go check them out. Harpeth Valley Dermatology. Hey, thanks again. We'll see you soon.
Thank you.
Thank you.
Bye.